Okay, we'll go ahead and get started while people are still filtering in. Please go ahead and introduce yourself in the chat. Just helps us all understand who we have in the room today. Thank you all for joining. I'm April Harrington. I'm the project manager of the Chicagoland Healthcare Workforce Collaborative. And today we are talking about best practices in community recruitment. How do we build effective hiring teams and community relationships? And we're going to feature programs from Rush and Sinai Chicago. I'm recording this, and the recording and the slides will be available on our website tomorrow. So you can share that with your colleagues or reflect on the recording and the slides tomorrow. For anyone who's new to the Chicagoland Healthcare Workforce Collaborative, we are a group of employers and industry partners that's been working together since about 2016 to support a more inclusive healthcare workforce and provide accessibility to underemployed and unemployed populations while addressing the ever-evolving and changing needs for talent in our sector. We do that through three strategic pillars. And the first one is what we're focused on today, local and targeted hiring. We want to make sure that we are hiring from the communities in which we operate, that we are offering opportunity, we're opening doors for populations that are underemployed, and that we are thinking about specific populations. I know a lot of us have a focus on fair chance hiring right now, or hiring individuals with disabilities. So that's what we're here to talk about today, local and targeted hiring. We also focus on bridging the gap between employers and our education providers. And we talk a lot about retention and career pathways. We want to not only bring people into healthcare and into frontline roles, but we want to make sure that we offer opportunities to advance into wealth-building careers in health. Like I mentioned, we're an employer-driven sector partnership. We have about a dozen employers at the table. 6 of those sit on our steering committee, and we're supported by more than 20 strategic partners, including training providers, community organizations, funders, and advocates. Welcome to those who are new. Before we jump into today's event, I wanted to highlight our first in-person quarterly meeting of the year. Very excited about this in a little less than 2 weeks on June 11th, 8:30 to 10 a.m. at Malcolm X College. We will start promptly at 8:30, so I encourage you to get there a little bit earlier, around 8, to sign in, grab some breakfast, do some mingling. We will have some updates on our CHWC programs and initiatives, and then we'll introduce 2 new projects that CHWC is a part of. One is a collaborative grant won by the Chicagoland Workforce Funder Alliance in partnership with CHWC and Malcolm X. And that will allow us to dive into some data from Malcolm X and their student population, and then create a pilot project aimed at increasing participation from men of color in healthcare career pathways. The second project is being led by Women Employed. They have some funding to do research around lifting up best practices and system barriers around healthcare careers and economic mobility. Some of you might remember that CHWC did some research with the Workforce and Organizational Research Center over the past couple of years on frontline employees' perceptions of their opportunities to advance. This project is actually going to allow us to take a deeper dive into that data that we collected, do a little bit more analysis on the survey results that we received. So I'm excited about that. And then finally, it's in person. It's so great to connect and have discussions with each other in person. So I want to make sure we have enough time for that on June 11th. We'll have some table talk conversations. I want to try and get together people who work on similar projects to learn from each other and discuss. And we'll be talking about how we might all work together to ensure more people are reaching wealth building roles in healthcare. So let me drop into the chat the link on our website. All our CHWC events are always listed on our website, and recordings are also added there, although we will not be recording this in-person meeting. So click on that link. Please send it to your colleagues, invite them, and register. I am asking that you register for that. So now getting into the topic for today. Over towards the end of last year, in our year-end quarterly meeting, our first quarterly meeting of this year, and our February employer peer learning session, we talked a lot about, what are our shared challenges? What do we want to learn from each other? And a couple of themes emerged. One is, how do we effectively partner with community organizations who are working to upskill community residents, to help them find job opportunities, to help them navigate their opportunities to start a career? How do we make those relationships work really well? And then how do we make our teams, our internal teams around hiring and retention, serve the needs of community residents better? How do we make sure that people are coming in the door, they're actually getting hired, and they're staying and they're retaining? So I've brought together a couple of systems. Dana Anthony is the community sourcing consultant at Rush University Medical Center. She actually presented to our group a few years back on the model that Rush has built to bring in community residents. She's had more than 3 years in the role, and it has changed, and she's learned some things over that course of time. So I'm excited to hear from her again today. And then we have John Figiel and Dovid Sukenik from Sinai, Chicago. They were able to build a pretty high touch program to bring in community residents called Healthcare Forward. They did that in partnership with a couple other systems several years back, and then were able to continue the program within Sinai, Chicago. It's a really interesting model that I think you'll all benefit from hearing from. So we're going to have each of our systems do a brief, maybe 10-minute presentation on the components of their model and their strategies. And then we'll move into a panel discussion and wider discussion. So I encourage all of you who are here to put your questions in the chat, be ready to come off mute. And also, we'd love to hear from you. We have lots of other health systems on the call here today. If you have some nuggets of wisdom to share with the group, we'd love to hear that. So first, before I hand it off to our team at Sinai, I'd like to start with some level settings. And why are we here? Why do we care about community recruitment? And what does that mean to you? What does community recruitment mean to you, and why is it important? I'd like you to respond to this in whatever way feels comfortable. So I'm gonna add it to the chat. Feel free to respond in the chat. But would anyone like to come off mute and respond to this question? What does it mean? Who are we talking about? Why does it matter?
I can go. I think for us at Rush, community recruitment means making sure that we're providing an equal playing field for applicants, especially those from Rush's surrounding communities. So many of you know we have a focus of hiring locally from the west side of Chicago. We have 11 zip codes that we actively try to hire from. And something that I know we've heard, and Tina can talk to this, is that a lot of these individuals in these communities are sometimes intimidated to even apply, or just don't know what the role entails, or just have a lot of different barriers that keep them from being able to pursue a job at Rush, and are more deterred from doing so than your typical applicant that may live, in a more well-off neighborhood. And so we've taken that to heart. And I think for us, community hiring means making sure that we're reaching the community, letting them know about roles, and then helping them through the process. And so it's just really important to us that there is some parity in the playing field, and in the same way that we're taking resources from the West Side community by by virtue of existing there, and having our operations entirely, placed in the community, that we're also devoting our human and economic capital there. So for us, that just means being more present in the community and making sure that we're providing that help to those applicants.
Thanks so much for sharing, Natalie. I heard, anchor mission strategy, recognizing that uh, you have the ability and to invest in the community in which you operate. And also a recognition that in order to level the playing field, you might need to take a more active role. Does anyone else want to reflect on this question, whether in the chat or feel free to come off mute? Okay, I hope everyone is enjoying lunch right now. I'll let you do that. Um, let's kick it off then, and hand it over to John and Dovid to share Healthcare Forward's model from Sinai, Chicago. Again, as they're presenting, please think about your questions. Feel free to put those in the chat. But we'll just have a 10-minute presentation from then, and then move on to Dana, and then move into a panel discussion. Take it away, Dovid.
And John, are you able to speak? Are you unmuted? I think John's going to start us off. If he's having trouble with his connection. First of all, can everyone hear me?
We can hear you.
Great. Okay. John might be having an issue with his connection, in which case I will start it off. Okay. Hi, everyone. My name is Dovid Sukenik. I'm with Sinai, Chicago. I am an operations specialist with the training and development team. And together with John Figiel and other members of our team, we've run this program called Healthcare Forward in different iterations over the past 3 or so years, spanning 2 different grant periods. We'll talk about that now. Healthcare Forward, the main objectives are to employ members of our community. We want to see employment widespread in our community for everyone's benefit. We want to promote healthcare careers, and we want to fill positions in our hospital. Of course, that's an important priority for all of us in healthcare. The key advantages and elements that we are working to build into this program is, first of all, to prepare them for an interview. Some people might not be skilled or practiced at the interview process. We want to match them up with the skills matching, especially was one of the versions of our program was very important to show the applicants where they might best be directing their effort, where their capabilities might lie and their interests. So that was a very important part of it. April mentioned this before, a high-touch process was very important to us. We want to be closely involved with them throughout the process. And this is, we call a fast track to the interview and a special consideration. What this means is that we want to bypass as much red tape as we can and get them right to the people who are going to be able to help set them up for and then interview them to give them the best chance. This doesn't mean that we're going to hire people who are unqualified, of course, but it means that we're going to look a little bit deeper and work with the people to make sure that we're not overlooking people who are skilled just because they might not have a classic background or some kind of experience. So basically, as you could see here, there were 2 parts of our program. One was funded by Chase. We'll call it the Healthcare Forward version 1, and then one by the Telegen Foundation, which is our 2.0. The first one spanned, this was actually part of a collaboration, which was 3 different programs in one. I'll talk a little bit more about that. But basically, over the period of a year and a half or so, was that first version. We'll get into details. And then the next one was about a year, a little bit less. And these programs are very different. I want to talk about some of those differences, and how we kind of adapted, hopefully to make changes for the better. So the first one, as I mentioned, was a collaboration between Sinai Chicago Advocate Aurora and UC Medicine. This was very innovative, and there's a lot to say about this type of collaboration and the benefits that were had. The community-based organizations, the CBOs, who were essential, and actually I want to give a shout out to Michelle McFarland and Elaine Ross, who I think are both on this meeting from Equus and from Kara. They were very important partners to us throughout, and they helped to recruit their constituent job seekers, and they worked hand in hand with us throughout the process. This first version, it was very broad, and we really promoted it widely throughout the community and in media, in different venues. And we had the consulting firm called Win-Win, which not only publicized the program, but also conducted the training sessions. And that was an essential component. The tools and the process for moving the candidates forward, we had a lot of things. We have people who were dedicated to it. We had online collaborative tools that were dedicated to it, and that was an important part. What this consisted of was this initial version was a 1-day seminar for 3 hours, and everyone would come and sign up and be given a login and join, and for 3 hours they would learn about some of these topics. As you can see, it has to do with them understanding themselves better, what their aptitude is, what their motivations are, and then learning also about the hospital systems, what kind of jobs we're offering, and finally, to give them some tips and interview prep so that they could do the best they can on the interview. And then from there, they would go to the recruiter team and be screened, and then move along to finally to the interview process to hopefully be successful there. So it was, I would say, complex, a lot of different parts of it, and that's kind of the model that we had initially. The second adaptation was only Sinai. It wasn't a collaborative anymore. This is the last part of it, the last year. Instead of a 1-day seminar, it was 60-minute sessions, 3 of them. What we did was we tried to zero in on what job specs they required before they even entered the program. So we were telling them what kind of jobs we have available now, what the salaries are, what the locations are, what the shifts are. So it wouldn't be a surprise later on, or they wouldn't try to figure out what fit for them. The goal really there was to align as closely as possible right away before they even entered. The CBOs were critical in terms of vetting the participants, as I mentioned before, and the adjusted curriculum was now talked about customer service training, which is essential in all these roles, resume writing, interview tips, and it was a smaller goal that we had, as you'll see in a minute, and therefore there was more individualized attention. So some of the outcomes, just the stats to begin with, we had over 400 people trained in 48 sessions. So 48 sessions, as I mentioned, in this first version, it was just a 3-hour seminar, and we ran 48 of them over the course of a year and a half or so. And we trained over 400 people. The second one, again, much more targeted, trained 17 people in 4 cohorts. We hired 77 people over our 3 systems in 22 different clinical and non-clinical roles. So everything from environmental to patient access, different medical assisting and tech roles. Their average salary was a little under $21 an hour, which we're very pleased with. There were some outliers which were much higher than that, but mostly it was roles that earned about upper teens and lower 20s. And there was $2.5 million of benefit overall to community families with these now salaried and benefited employees, which also we're very proud of. So here's some lessons learned. This is what worked. Like I said, the collaboration of hospitals was really groundbreaking and beneficial in a lot of ways. We had to learn a lot about each other, and we had to work well together, but we clearly saw a lot of benefit and even future potential in these kind of collaborations. As I mentioned also, the community partnerships, that was essential with Kara Equus and others. The marketing and training firm, that first version of our program where we widely marketed it, there was reach that we could not possibly have had in the training. They expanded our capacity in ways that we couldn't have done otherwise. The centralized project management, the fact that we had tools to keep everything unified, everyone on the same page. Like I said, it's a complicated process in a lot of ways, a lot of cooks in the kitchen. We were able to hopefully keep everything on track by keeping that centralized. And the candidate coaching also, that was another example of the high touch kind of service to really shepherd these candidates through the process and help them hopefully towards success. Here's things that we learned that really could be and should be improved upon. So for example, the internal coordination prioritization, as I'm sure many of you could recognize, you have a big organization, and so there's a project team, and we have certain goals and how we think that there's benefit, and we have our mission, and we want to align that closely with the internal process of hiring, which is ongoing, and they have their goals and pressures, and to be able to align them and make sure we're on the same page is really essential. And it's something which needs a lot of attention, both obviously when launching the project, but also throughout. To support the participant follow through, a lot of these candidates have a lot of challenges, and there's some significant drop off, and the approach needs to be both from the perspective of us as the hiring party, as well as the support that their community organizations provide to work together to support them in being able to follow through, to make their best impression and have the best chance at a successful interview. And finally, to ensure job availability, it's a little bit of a moving target because, like I said, we're trying to fill certain jobs, but we're also bringing candidates with certain skills and needs and requirements and all that. And to get those to line up at the right time, in the right way, is a big challenge. And that's something that clearly needs to be solved for. So just to wrap up, 3 main conclusions that we had. The first one may be obvious, but it's really worth pointing out. Hospitals have a lot of different jobs, clinical, non-clinical, and there's applicants out there that have different and maybe unconventional backgrounds, but they have skills and they have passion, and we have to kind of sometimes think out of the box as to where they are and how to meet them. The second one is the amount of time and resources needed, and this was emphasized to us over and over. Fortunately, we had that grant funding, but there was a lot of time that needed to be expended to be able to produce these programs and to run them, especially again because we're working with people who have challenges, and it takes even more of an investment to be able to help them through the program. And finally, the commitment that's necessary. That's both internal and external partners for successful outcomes. So the benefits are great and they are to be had, but it's really important for everyone not just to commit and to pay lip service to the mission and to the process that we're engaging in, but really to follow through with it and view it as a joint mission and priority. So thank you very much all for listening. Thank you, April, for the opportunity, the invitation to talk about this. And if there's any questions, of course, we'll talk about it now, and feel free to reach out in the future as well.
Thank you so much, Dovid. It's a very impressive program, and I already have questions, but we're going to hear from Dana and then move into the sort of question and answer panel portion. I know others have questions too, so feel free to throw your questions to Dovid and the Sinai team in the chat, and we'll make sure to get to those. With that, Dana, would you like to take it over and tell us about your strategies at Rush?
Okay. Thank you so much. That was kind of a hard presentation to follow, but thank you. I'll do my best. So as April mentioned, I am Dana Anthony, the community sourcing consultant at Rush University Medical Center. Excuse me. I've been at Rush now for a little over 3 years, and I apologize. I'm trying to get it in presentation mode, but I can't see because I have this tab at the top of my screen, so I can't see. I can't see where I'm clicking. Hold on one second. Okay, I'll try this again. Nope, and I still didn't move fast enough. If I can get some assistance, April, and I do apologize that I'm not able to figure this out.
How should I do
that? There it is.
There we go.
Okay.
All right.
So apologies for the technical difficulties, but again, Dana Anthony, community sourcing consultant at Rush University Medical Center. I have been privileged of working at Rush for about 3.5 years, and it's kind of full circle because I believe when I first got into the community sourcing role is when I did my presentation the first time. So how cool is it that I get to present again, just about some of the great works that we have done over that time. So, of course, Rush, we're a hospital, we're a place of healing. One thing about our health systems is we have a mission to improve health of individuals and diverse communities that we serve through an integration of outstanding patient care, education, and community partnerships. Excuse me. Our eye care values are really big at Rush. And so you may see it come up a few times in my presentation because it is really what we strive to accomplish on a day-to-day. I know definitely for me, I look at the eye care values, I have them memorized, and this is what I live by to make sure that I'm doing my best in providing services for my community partners and their participants. So our eye care values are innovation, collaboration, accountability, respect, and excellence. And I don't need to read all of that verbatim, but those are the things that makes Rush who Rush is. So our innovation is actually what kind of got us into the community sourcing. Excuse me. So the community sourcing, what I do is I partner with community-based organizations that are primarily on the west side of Chicago. I do have south side and just the Chicagoland area. I have community partners who have a pipeline. We've created a pipeline where they have talent of people who are looking to fill the roles that we have available within our systems. So we have 3 locations, and then we have satellite and various little satellite locations. So we have our Rush University Medical Center, we have Rush Oak Park Hospital, we have our Rush Copley, which is in Aurora, and then again, just some satellite sites that are scattered throughout the Chicago area. So what I do is I partner with these agencies and I source their talent. So they already have pretty much a workforce component where they have done some job readiness training. They've done resume writing, interview prep with their participants, and now they are looking to get connected to employment opportunities. One of the ways that I help with that, one thing for me, I like to eliminate barriers. So I have this picture on my desk that I look at every day, and it's a picture with no barriers. And my goal is, in addition to the iCare values, is to remove barriers. And so I do application hub sessions as a way to help eliminate those barriers, because everyone on this call today has had to apply for the job that they have. And it can be overwhelming. It could have been seamless. Someone could have actually sought you out for the opportunity. Nevertheless, there were probably questions that you had when you weren't in front of a recruiter or a sourcer to find out more information about the position. And Sinai had talked about this earlier with making sure that we kind of remove that stigma of healthcare opportunities and not just thinking that they're on the clinical side. So I jokingly tell people, and some people might not find this funny, I tell them, if you see me walking with a scalpel, you probably should tap someone and say, get me out of here, because she does not know what she's doing. I tell them I'm not a doctor and I don't play one on TV. However, I am an employee at a hospital. And just to help remove some of that unease that they may have, uncertainty when it comes to the opportunities that they could look forward to applying for within our systems. So our application hub sessions are just that. Those are ways for me to help to remove those barriers, answer some questions for them, show them how to navigate through our ATS system, which can be very overwhelming. And then there are also times where I'm able to get a recruiter on the call to talk about some of those positions, because then that way the potential applicant has a way to find out what we are actually looking for. So they're hearing it direct from the recruiter's mouth. So it's not speculation, it's not guessing. They're letting them know what an ideal candidate looks like. I also have partnerships for positions that we don't necessarily offer at Rush. So Concordance Healthcare Solutions is one of those partners as well. So if there are opportunities that Concordance may have that we might not have at Rush, because I'm working with community partners, I will refer them to opportunities at Concordance as well. So on your right-hand side, you'll see an old snapshot of the percentage of our anchor mission hires. Later on in the slide, I do have some updated data, but this is just the data from when we first kind of rolled out the anchor mission initiative of what our goals were. So in FY 18, 19, 20, and 21. So why are we committed to serve the West Side community? Because it kind of makes sense for us to be in the West Side, on the West Side, and have people from that area to work in our systems. So again, I have the mission here, our vision, and then here again is that iCare values that I told you really rings loudly through the halls of Rush. So Rush did an assessment, and what they found in this data, which is kind of alarming, is that you see our three systems here. So this is Rush University Medical Center. This is, of course, the Oak Park Hospital, and then this is Aurora. And so they have the life expectancy of those communities. So what we found is that there was a huge life expectancy gap between the west side of Chicago and the Loop. And so anyone who has been downtown, you know, Rush is not really that far from the Loop area geographically. So why is it such a huge life expectancy gap? So Rush thought, you know, let's do something about that. And that's where Anchor Mission came from. So these are our target communities system. So we have our location at the RUMC, or Rush University Medical Center. So those are the 10 zip codes here that are listed on the left-hand side. Oak Park has a list of Anchor Mission zip codes as well. And then Rush, Copley, and Aurora has a list of zip codes. Now, what does that mean? Those zip codes, they do not automatically get higher because they're from that zip code. What we are doing is giving them a closer look to provide them with an opportunity to come on as a staff or an employee at one of our locations. So application hub sessions, again, I mentioned that's something that we do, excuse me, and it's just a way to help remove those barriers, help them to be targeted in their search, because again, our website is overwhelming. I work at Rush. I look at the website daily, and it can be a lot, especially if you really don't know how to navigate through the system. We at times have over 600 positions that are available. And if someone is not clinically trained, but still interested in looking at opportunities, they kind of wouldn't know where to go to find those opportunities. So the application hub session is just that. I show them where to go, how to target their search, and then just talk about the different opportunities, talk about some interviewing tips, talk about what an ideal candidate would look like for them. Again, removing those barriers. And I apologize because there was a slide. I think I pulled up the wrong deck, because I did have the data that shows our percentage. So each year for our fiscal year, we come up with a target goal of hires from our anchor mission zip codes. So I know you all saw, and let me go back. You all see this outdated data here where it has the FY18. So it was 16% there. This year, we are at 18% for our goal for the FY24 year. We are slightly under. However, that data, the raw data that we've last collected, was from March of this year. So we are definitely on track to meet, if not exceed, that goal of 18%. And again, just because they live within those 10 zip codes does not mean that they are automatically brought on board. What that means is that we want to make sure that we're giving them a closer look, because there is a lot of talent in the community that surrounds where we are providing healthcare services. I'll find the correct one. I apologize. I was trying to hurry up and pull it up and having issues pulling up the full screen. I pulled up the wrong one. I will get that, and I'll share it. And then that's it. If anyone has any questions.
No worries about that, Dana. We can include the correct deck.
Yes.
The follow-up. So that'll be on the website with the recording. And so now we'll move into more of a panel style discussion with Dana and Dovid and John. And thank you, all of you, for putting together those presentations and giving a high-level overview. I'm curious, both of you spoke about the importance of working with community organizations in order to source your community candidates and to support them through the process. Can you talk a little bit more about your partnerships with community organizations? What makes that partnership work well, and what has been challenging for you?
So may I go first?
Go ahead, Dana. Yeah.
So we have a tier system with our community-based partnerships. So some of our community partners have more services and resources that they are providing. For example, Kara is a really great partner that we have. And what they do is they'll send me their talent. I communicate bi-weekly with someone who's been assigned to our Rush account. So we talk about things that are going on, the status of applicants, if someone has been offered a position, kind of if things are still in limbo. And one thing that is great about that partnership is the transparency. So when we have our meetings, we are talking about the things that may possibly have an applicant not moving forward in the process, maybe thinking about having them revise or revamp their resume, or working with them on interviewing. Because I've had some participants who may not have been selected for an opportunity, and my community partners will ask if I've gotten any feedback. And then I will speak with the recruiter and say, hey, do you have any feedback on this particular applicant? You know, they're from one of our community partners. I would like to have that communication, that conversation with them, just so that they know how to work with them going forward. So even if they aren't going to apply again for another position at Rush, then they still have that skill set that they may kind of be missing when it came to interviewing with us. What was the other part of the question?
I mean, I think you've hit on what makes your community partnerships work well, which is transparency, communication. Are there things that have been challenging in navigating those community partnerships?
It is challenging because I'm a team of one in a sense. And not only do I have community partners, I also attend a lot of events. So a lot of people see me at hiring events, career fairs, mock interviews, and it is a lot that I keep up with kind of on my own with the work that I do. There is a workforce team. However, this community partnerships, a lot of that does fall on me. So even kind of like balancing them out, because sometimes I'll have partnerships that will really thrive. And then I have some partnerships that, you know, referrals, they don't really communicate. When I reach out to them to extend services for application hub sessions, they may not feel that there's a need for it at that time, or they don't have the participation that they would like to have, so they don't, you know, engage with us as much. So that, I would say that those are some of the challenges of having the community partnerships, just being able to balance and, you know, understanding that some will kind of fall off and some will resurface and some will really be strengthened and some will have to have those really uncomfortable conversations so that we can be in a better place with our partnership.
I just wanted just to echo some of the things that Dana has been talking about. Was it really everything that you're describing is a lot of our experience as well. It really, working with the community partners is all about the details. It's like getting into the weeds and talking about the exact experience with every applicant and how we could smooth the path and remove barriers, as Dana has been talking about. And that's really where you see the success. A challenge also that we found is sometimes because we're running a program, we might have a cohort starting at a certain time, but they also have programs, and you know they might not be exactly synced up. So you know, making sure that there's a lot of communication and the more planning that we could collaborate on, you know, the better, clearly the better outcomes we're going to have.
Communication. How many learning events have we all been in where it comes to what could make this better? More communication. But thank you both for sharing that. And on the flip side, you know, your internal teams, I think, Dovid, you spoke about this, Dana, you spoke about this as well. And I know that our partners at CHWC have talked about this, is how do we make sure that recruiters, hiring managers, anyone else who is involved with this process, that they're all on the same page and that they understand competing priorities. Some may, you know, it may be your role to make sure that you're doing anchor mission hiring, or it may be your role to make sure that you have the most experienced, capable team, and those can, you know, come into alignment, but sometimes they can be at odds. So how have you all worked to make sure that your internal teams are set up to participate in community recruitment, to make sure that candidates are actually successful getting through and getting hired? Any lessons learned there?
I'm just kind of a pest with my recruiters. If I do get an anchor mission applicant, I am sure to highlight it. We also have it now in our system where it will flag an anchor mission applicant, regardless of if they self-identify based off of one of the zip codes, because it will just automatically flag if they enter one of the 10 zip codes. But I do send their information over to the recruiter, and I'll highlight the zip code, and I'll also mention this is an anchor mission hire, so that they are aware that this is, you know, what the goal is of getting anchor mission hires in.
And hi, everyone. This is Michelle. So even just thinking of what Dana had shared about what she sends to the recruiters in terms of identifying individuals who they may be interviewing with or consider interviewing with at their anchor mission, I think that that's ultimately important, even to help set expectations of hiring managers, that even though an individual may have received mock interviewing support or, provided with tips on how to interview, that sometimes they may not interview well just due to the barriers that they're facing. And that's why they're anchor mission or other missions, if you will, but not to just write them off because that interview didn't go so well or, how they thought it should go. So I think that's good. And that's similar to how we, work with other employers as well by identifying them or have plans to identify them as being in the program and having support with those type of, lessons that they need, mock interviewing, retention support. So I think it's important to identify.
And so, Michelle, I actually do facilitate mock interviews with one of my community partners. That is a part of our relationship. So when they have cohorts that are going through their program, when they're getting to the resume, job readiness, interviewing part, they have a few different employers that will come in, and I will come in and interview with them and ask them a series of questions, give them some feedback. So that, again, goes to just one of the beautiful things about those community partnerships, because they are catered to the need of the organization that I'm partnering with. So yes, so those are very important.
Agreed.
Thank you, Michelle, for jumping in. And anyone else feel welcome to do that as well.
Yes, hi. My name is Brandon Taylor, and my question is, I'm at Rush. My question is that how do you integrate, or have you had thoughts about integrating a system where, like some college programs are doing now, where students don't have to apply to college, they fill out a profile in a database, and then the colleges basically scrape that database to get qualified applicants. It's an effort to facilitate removing barriers of students trying to figure out which programs to collaborate. So I just wanted to get some thoughts. Has anyone thought of that, or someone doing something like that, like a community database where all the systems can reach out there and get applicants who are qualified from the community? They would have some type of flag that they participated in one of our workforce development programs to kind of get extra points, like a veteran status, if you will, as an example. And then my other question is, for your community programs, such as like internship programs, things of that nature, how do you integrate that as well into your process?
Interesting.
I'm sorry.
Go ahead. No, go ahead, Dana.
So as far as the internships, that would be a different area from what I'm more familiar with. However, to your point about capturing those interests, we do have a Connect with Our Talent community on our career website. And I've created a QR code and taken that to events where people can just scan it, or they can go to the website and they can fill out the information to let us know their area of interest. And that is data that is collected, and the sourcing team has information. They have access to the information. So it gives us an idea if we need to host an event for maybe an access specialist, hiring event, or if there's a high need for any of our EVS positions that we have. So we do have that readily available for them. And then we have Kevin, who is our spokesperson. He's a really good connect for people with disabilities and for our veterans. He's on the sourcing side as well.
Thank you.
I want to make a comment about, and maybe this is kind of responding to Brandon's question. And, we're all looking to reduce barriers, but there's something else that we found, which is that if you make it, I don't want to say too easy, but you need to have a certain amount of buy-in from the applicants, and they need to show commitment to follow through with some basic steps. So there's a real balance in how you want them to, take initiative for their own career search and take those steps. And at the same time, you want to make it as easy as possible for them to do that, so they're not at a disadvantage. So that's something just to think about as how do we try to balance that.
Thank you, Dovid. Brandon, thank you for your question. I think what you were referring to about sort of a large database of everyone who is engaged with workforce development organizations. I believe that was tried recently, and I'm blanking on the name of the initiative. Happy to follow up with you about it. If Elaine was still here from Kara, she would know what I'm talking about. But I think both of your questions were sort of driving at, how do we integrate all these different systems and initiatives that we have to make sure we're sharing information effectively, and so we get to a point where we perhaps don't need to spend as much time and resources getting the word out about particular initiatives and programs, which is a large question. And on that question, pose another question to Dovid and Dana and John. It's good to see you. Glad you're able to join us. Feel free to jump in at any time. If you had more resources and any type of resources, time, money, people to devote to community recruitment or community sourcing, where would you invest?
I'd like to hear John's answer to that. If you give him more resources, I want to know what he's going to do with it. Yeah, John, you have all the money in the world now.
I've got all the money in the world. Yeah. Thanks for that. And I apologize, everybody. I was having problems with Zoom. So the original plan was I was going to do the first couple slides and then Dovid was going to pick that up. So Dovid stepped in and took on the whole thing. So great teamwork, Dovid. Appreciate you stepping up to do that. And Dovid and I actually, April, that's a really, really good question because we've been talking about this a lot. And I'll give the short version of our long conversation. And we've had some success, as you saw. And I think we've hit a point where we know that we keep doing the same thing, we'll keep getting the same results. How do we take it to the next level? So we've been talking about, and we just started the conversation, by the way, so maybe it's, other folks' thoughts would be great as well. How do we maybe take a step back, go back to that clean whiteboard and rethink the challenge, the goal, as well as the process? Brandon brought up a really interesting point because, one of the things that we learned is there's a lot of people in Chicago focused on this, and they're doing the same and similar work. And there's a real opportunity there somehow, I don't have the answer, to leverage that. So that's I think an area where I would want to spend some money to really figure that out. Because we always try to put ourselves in our client's shoes. If I'm a resident in North Lawndale, which is part of the community that we serve, I might have 4 different CBOs I could be working with. We've actually had people come through our program like twice from different CBOs. It's like, wait a minute, haven't you been here before? So that would be a place where I would spend some money. I think the other area where I would spend some money is really thinking through the internal connection piece with our hiring managers. So I think, when we go into this, I think, hey, Sinai has jobs. We've got a lot of jobs. We've got people in the community who are looking for work. Let's just get together, right? That seems pretty simple, but it's so complicated, as we all know, to make that connection. And the one piece that we really haven't spent time on is that hiring manager. We've got recruiters on board. We've got partners on board, but that hiring manager has to be one quick. It's like, we're waiting 3 or 4 weeks to get an interview on somebody's schedule. And I'm not criticizing them. They're busy. But there's something we haven't, there's a code, there's something that we need to do to work with our hiring managers so that they're pulling candidates as far as opposed to us pushing them. I feel like sometimes we're pushing our candidates and waiting for somebody to take them. We want to be in a position, Dovid and I talk about this, where people are knocking down our door. Hey, John, where's my candidate from the community? We're not there yet. So those are the two areas.
Oh, great insights, John. So glad you figured out the Zoom. Dana, did you have anything to respond to there or add?
Just to say I haven't been part of their conversation, but I've been having that same conversation as well. Definitely a challenge because they do have so much on their plate. And it is like we just want that extra nudge. Like we're putting them right in front of you. Just go ahead and just take them. Yes, I couldn't have said it any better. Thank you, John. I'm glad that you were able to get your system working to say that part.
Well, we only have 2 minutes, so I'm not going to ask another big question. Thank you all.
Can I ask a small question?
Sure, go for it, Brandon.
Hopefully small. So you mentioned about competitive wages, or and I guess what are some of the strategies? Because you know, some of the entry level positions, on the average look, they are not meeting like the MIT and the these other living wage calculator benchmarks. So I guess what are some thoughts, or have you done something to try to make sure that, for lack of a better word, social media meme was, if you can get $25 flipping burgers, but you're not making that flipping my grandmother, so it just curious of what strategy are to try to get living wages for these entry level positions that a lot of the community members, may qualify for.
I'll jump in and just say really quickly that we are on a regular basis, our compensation team is out in the market doing research, because and I'm going to generalize, right? So please don't take this to heart, like to every position. But the market, as we all know, changing so quickly, it's so competitive that we're always trying to make sure that we're up, to speed with that market. And your question's a really good one, Brandon. We're doing that for all of our jobs. And so we get feedback from our comp team where we can improve, as well as from our candidates if the jobs aren't meeting their needs. And then we try to match those up. So it's not a strategy. It's very much more of a tactical, kind of reactive approach.
Thanks for that question, Brandon. I would argue that it's a big one, and something we talk about at CHWC a lot. So hope to see you and everyone here at our in-person meeting on June 11th. It'll be exciting to have some of these conversations in person. That question in particular, Brandon, is on the agenda. So sorry. Thank you so much, John. Dovid, I apologize. I think I've been mispronouncing your first name this whole hour. I'm so sorry about that, but thank you so much. And Dana, thank you again. It was just a great conversation. I look forward to more important conversations within CHWC. Recording and slides will be on the website tomorrow. Thank you all. Enjoy this beautiful day.
Thank you. Have a good one. Don't forget the correct slide.
I will.
Thank you. Thanks, April.
Thank you.